Welcome, everyone. Thank you for joining us today. My name is Alyssa Tay, and I'm with the Collaborative for Health and Environment, also known as CHE. I'm going to get us started with some quick housekeeping items. This webinar is hosted by the EDC Strategies Partnership. The partnership members include Healthy Environment and Endocrine Disruptor Strategies, or HEEDS, which is a program of environmental health sciences, Commonweal's Biomonitoring Resource Center, the Health and Environment Alliance, or HEAL, and CHE. We invite you to type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentation. If you'd like to activate closed captions, you can do that by clicking the button at the bottom of your screen. This webinar is being recorded and is scheduled to last for 30 minutes. If you'd like to download the slides, please visit the webinar page on our website at healthandenvironment.org. We'll put that direct link into the chat now. I'll now hand it over to our moderator, Jinan Jensen, Director of the Health and Environment Alliance.
Thank you, Alyssa, and good afternoon and evening, everybody. I wanted to provide a warm welcome to this webinar that's organized by the CHE EDC Strategy Partnerships, and it's called the Children's Health Assessing Impacts of the Exposome. My name is Jinan Jensen, and I'm the Executive Director of HEAL. And for those of you who don't know, HEAL is an alliance of over 80 member organizations from the health community and other groups in Europe and beyond. And we're working really for better health through a healthier environment. So today I'm really excited to introduce you to our speaker, Rémy Slama, who is an environmental epidemiologist and senior investigator at the French National Institute of Health and Medical Research, also known as INSERM, in France. Rémy is also formerly a member of the Scientific Committee for Health, Environmental and Emerging Risk of the European Commission's Directorate General for Health and Food Safety. And in this webinar, Rémy is going to share with us his research as part of a European-funded project called ATHLETE, which focuses on the human exposome. ATHLETE aims to better understand and prevent the health effects from the exposure to numerous environmental hazards and their mixtures, starting from the earliest stages of life. And Rémy today is going to explain some of the health impact studies that have been done in the project, what factors from the urban and chemical exposome have been examined to look at their influence on children's health, and also how these insights on exposures can help us define risk factors and, really importantly, future policy actions. So with that, I would like to give a warm welcome to Rémy and invite you to begin your presentation.
Thank you. Thank you very much. It's a pleasure to be today with colleagues interested in environmental health issues from all over the world, and in particular from the US Environment and Health Research and Policy community, which has been and will remain, I am sure, a source of knowledge and inspiration for many of us. The US scientists in particular have contributed to many of the results I will present by documenting the effects of lead, of particulate matter, extreme temperatures, and many other compounds in the US children population that this talk will discuss. Indeed, my aim here in this project, which I'm presenting on behalf of all my colleagues from ATHLETE projects, in particular from also my colleagues from ANSES, the French Environmental Health Agency, AS Global, and at INSERM, aims at providing an overview of the impact of the exposome, and in particular the chemical and physical exposome, on children's health. So starting with chemicals, we know that there are at least 23,000 chemicals with a rather high production level in the European market, which is only part of these chemicals because it excludes drugs, pesticides, and cosmetics, and only includes those chemicals regulated as part of REACH regulation. So that it's likely that the actual real number of total chemicals on the market or formerly on the market is probably closer to 100,000, and there are similar estimates on the other side of the Atlantic. For hundreds, if not thousands, of these chemicals, we know that through their presence in diet, everyday life product, or as a result of industrial emissions, they are also present in our bodies, and in particular in the bodies of pregnant women and children. And this has been clearly documented by epidemiological cohorts and large biomonitoring surveys, such as NHANES in the US, led by the Center for Disease Control. These chemicals are only a part of the exposome, which has been defined as encompassing all environmental factors with the possible health effect that one undergoes from conception onwards, and that includes not only these tens of thousands of chemical factors, but also physical factors such as radiation, heat, psychosocial factor, behavioral factors such as tobacco smoke, or biological factors from an origin external to the body, such as infectious factors, in particular virus, bacteria, eukaryotes. This exposome concept has been defined 20 years ago by Christopher Wilde, and research on the topic includes many essential questions, starting from the characterization of the exposome and the description of the exposures of large populations, the study of the contrasts in exposures across social groups or across territories, which is connected with the question of environmental justice, the question of the mode of action of those components of the exposome with an effect on health, of the specific health effects that can be induced by the exposome as identified by toxicology, by human cohorts, epidemiology. So specific clinical endpoints, identifying whether or not a substance is a carcinogen or a reprotoxicant. The quantification of the corresponding health impact, and here I use the word impact, distinguishing it from effect, as the share of the disease cases or as of the healthy life years lost because of a specific exposure. And of course, the important question of knowing whether and to which extent we can control this exposome, decrease the harmful exposures in order to improve public health. And of course, here research can also contribute via intervention, studies and documentation of beneficial impacts of adopted policies. I will today focus on only one question, and actually only a part of this question, which is that of the quantification of the health impact of the exposome on children's health. Health impact assessment studies, also called environmental burden of disease studies, typically provide estimates and results such as this table, which comes from the Global Burden of Disease study conducted since many years by the Institute for Health Metrics and Evaluation, hosted at the University of Seattle in the US, showing, for example, that worldwide in 2021, the #1 factor in terms of impact as assessed in DALYs, that is the disability adjusted life years attributed to the exposure, was particulate matter pollution, PM2.5. And you see here the list of other diseases and exposures, including smoking, but also lead exposure contributing to these healthy life years lost. This list is rather limited in terms of number of chemical and physical risk factors considered. And in particular, when we focus on the burden of disease studies conducted in children, they were so far able to consider not much more than half a dozen of chemical and physical factors. This may be related to the fact that we synthesis of the evidence regarding the effects of these chemical and physical factors, and in particular of a synthesis that would encompass not only the human evidence, but also the evidence from toxicology, which is essential, of course, in particular when we're talking about endocrine disruptors, for instance. For these reasons, we have undertaken, as part of ATHLETE EU-funded project, a study aiming at summarizing the impact of the exposome, and specifically, and what I will discuss today deals with the synthesis of the overall level of evidence regarding the exposome on children's health, focusing on specific factors, considering not only the human, but also the toxicological and mechanistic streams of evidence, focusing on the chemical and physical exposome. And the secondary aim was to identify the corresponding dose-response functions that could be applied in humans in future health impact or environmental burden of disease studies. These environmental burden of disease studies include many steps that can be summarized by considering that you first have to assess the level of evidence regarding each possible pair of exposure and outcome, health outcome, so as to identify the exposures that are most likely to influence children's health. In our case, you have to retrieve dose response functions corresponding to these exposure health outcome pairs, combine them with the distribution of exposure in the target population, with also the baseline number of disease cases or DALYs corresponding to each disease, sum all these across all exposures, all disease, so as to provide an exposome-wide health impact. And today we'll focus on the two first steps regarding the level of evidence and the exposure response functions, which we have done by a literature review. The components of the exposome in focus correspond to 88 risk factors belonging to the families that are listed here, including air pollutants, tobacco smoke, some pesticides, bisphenols, parabens, phthalates, metals, some perfluoroalkyl or PFAS substances, and POPs. And we have reviewed them in connection with various domains of children's health, including neurodevelopment, cardiovascular, metabolism, including growth, respiratory health, and others, including mortality and reproductive health. I'll be brief with the methodology, but suffice to say that we developed an approach allowing to rather quickly and efficiently and relevantly review the existing evidence, giving a priority to reports from environmental health institutions such as environmental health agencies, OSHA or other agencies in the US, the academies of science, or European agencies such as EFSA, or national agencies including ANSES and in France, or BFR in Germany. So if there was a rather recent report covering the exposure and outcome of interest and the three streams of evidence we were interested in, the epidemiological, toxicological, and mechanistic in vitro evidence, we would extract the information from that report and move to the next exposure and outcome. If this was not the case, we went into all the reports available, and if there was not a relevant coverage, we would focus on published reviews from PubMed, assessing their qualities with relevant scales, focusing on those of high enough quality, and extracting the conclusions from these reports and reviews, synthesizing the three streams of evidence so as to provide an assessment of the level of evidence, ranking, as you see here on the left part, from a very unlikely association up to very likely association between the exposure and the health outcome of interest. The first results are shown here, highlighting that for the 611 possible risk factor and outcome pairs that we considered with the ATS, risk factors, and the various health domains I mentioned, well, we had no information on the possible link for 81 of these pairs. We had some information for another fraction of the pair, and for 127 of these pairs, there was information pointing to a likely or very likely effect of the exposure on the considered health outcomes. That means about 21% of the exposure outcome pairs considered corresponded to likely or very likely effect, as documented generally by epidemiological and toxicological and mechanistic studies, or in some cases by strong epidemiological studies with more limited toxicological or mechanistic evidence. And as you can see, for about the remaining, which corresponds to about 3/4 of the considered associations, there was no strong evidence of an association. That is, the evidence was as likely as not or lower, or even in some cases, as I mentioned, there was no evidence at all in the reports we could identify. We have also mapped these associations showing the health outcome associated with each of the exposures. We can go quickly here. You see, for example, on the first line that passive smoking exposure to tobacco smoke, environmental tobacco smoke, was associated with respiratory effects, with a very likely association with cardiovascular health in the children, with metabolism and growth, and with other outcomes, in that case corresponding to a risk of mortality and preterm delivery. For the PFAS families, the level of evidence was diverse according to the compound, with a higher amount of evidence for PFOA and PFOS, which have been more studied, but also evidence for some of the other perfluorinated substances that we considered. Of course, a lot of evidence also for metals, including lead, with effects on neurodevelopment, well evidenced since at least the 1970s by pioneer American studies in relation to exposure to lead, in particular from leaded gasoline, but also effects on reproductive function and respiratory health. We have also ranked chemicals in terms of number of different types of children disease that they were likely or very likely to induce. So this is not the share of disease explained by the exposure, but simply the number of different clinical endpoints that they are likely to induce. You see here on the left that the compounds with the largest number of disease that could be induced were some POPs like PCBs, HCB, hexachlorobenzene, temperature, both warm and cold, of course. You see also that then several PFAS came, and that was a surprise to me that, of course, not only PFOA and PFOS, which have been widely studied, in particular, and reviewed in the US with the very interesting example of the C8 project, but also other members of the PFAS families corresponded to likely or very likely effects for one or two or more children diseases. Of course, passive smoking was associated with a large number of health effects. Bisphenol A, which will not come as a surprise with the large number of mostly tox studies. But next to bisphenol A, you might not be able to read it, but the neighboring compound is bisphenol S. So another member of the bisphenol family, which has been studied more recently, but for which the number of possible effects is already as high as it is for bisphenol A, and other bisphenols are here with emerging evidence already corresponding to likely or very likely effect, mostly from tox and mechanistic studies. I've mentioned the metals, air pollutants, and noise also were associated with a large number of effects. For phthalates, the number of effects was less important and mostly corresponded to effects on reproductive function and related to generally anti-androgenic effects of these phthalates. And nonetheless, this corresponds to associations deemed likely or very likely, just like all of those present in this figure. At the last step, we have retrieved this time only from the epidemiological literature dose-response function. I'm showing here results only for the chemical exposome, excluding air pollutants. For the 78 likely or very likely exposure outcome pairs for the chemical exposome, you see that we were able to identify a dose-response function from a meta-analysis of published epidemiological studies for 21 exposure outcome pairs. For 29 of these exposure outcome pairs, there was no meta-analysis available according to our criteria, but there was at least a single epidemiological studies that could be used as a dose-response function. And for 28 exposure outcome pairs, more than a third, there was no exposure response function available in the literature that corresponded mostly to effects with the likely effect based on toxicological literature, but for which there was a limited number of high-quality epidemiological studies. Our paper that is accessible online lists the specific sources and exposure outcome pair. Will not go in details and stop here after a brief summary. So starting from 88 risk factors from chemical corresponding to chemical and physical exposures, we synthesized the available scientific knowledge published worldwide regarding their possible effects on children's health, considering human toxicological and in vitro evidence. This is a methodology that we have developed that is similar to other methodologies that had been previously proposed to review a large number of environmental health studies. For example, the navigation guide methodology developed by Woodruff and Sutton about 10 years ago. Several factors of strong concern for children's health were identified, which are not totally surprises, I'm sure, for many of you. These corresponded to the chemicals and physical factors able to influence several types of children's health outcomes, from neurodevelopment to respiratory, metabolic, cardiovascular health, including the PCBs, other POPs, temperatures, many perfluoroalkyl substances, passive smoking, arsenic, lead, several bisphenols, parabens too also. Some of these risk factors are strongly regulated worldwide. This is the case of PCBs, PFOA, PFOS via the Stockholm International Convention, which to my knowledge has not been ratified by the US, if I'm not wrong. For other factors, regulations and efforts are more limited or heterogeneous on the planet. For example, the PFAS other than the PFOA and PFOS. Temperature, of course, for which there are efforts in many countries to fight climate change following the Paris Agreement. The phenols, also including parabens, although for some of these factors we have interesting regulatory initiatives in some areas of the world. For example, the European Union has just banned PFAS in toys. France has just adopted a PFAS ban across all sectors but the relevant sector of frying pans. The European Food Safety Authority has developed a new and much lower tolerable intake for bisphenol A. The project importantly also identified risk factors with limited level of evidence, which could be areas for future research. I'll stop here, thanking very warmly all my colleagues from ANSES, INSERM, including Audrey Rocablois, ICE Global, and CNRS, and the funding from the European Union. Thanks a lot.
Thank you very much, Rémy. Really excellent presentation on a very complex and a piece of scientific work. One question, so people can drop their questions into the chat box, but I have one question for you as we get started. And I was interested when you said that you were surprised when you were looking at the PFAS, and it wasn't just PFOA and PFOS, but there were other members of the PFAS family that came into the likely or very likely risk factor, I think is what I heard. And I wondered, if you could say more about what those other, or is that too complicated of a question? If you know
Well,
that, yeah.
the question is not complex, but the list
Yeah.
might be a bit boring because,
Yeah.
as you know, there are thousands of PFAS. They all have very complex names and even more complex, of course, formulas. So the most well-known and studied and as I mentioned, well identified in terms of adverse health effects are PFOA and PFOS. Many industries have stopped using them. There were several others with effects, including PFNA, PFUNDA, and others. So the name are not very explicit, and I need not to list all of them, but this shows that in spite of the rather recent concern for PFAS in EPI studies, we have been able to identify these compounds only in the last years. There's already quite a large evidence for some of the PFAS and showing effects similar, if not exactly identical to those from PFOA and PFOS.
Okay, thank you for that. So I have a question about, first of all, is it possible to have the list of the 88 risk factors that you studied, and where can people find that, if so?
Yes, so it is possible to access, of course, the list of all the exposures and also the dose response functions that we have identified. We haven't tagged those that are endocrine disruptors, but that can be done by crossing our list with a list of endocrine disruptors. Clearly, we have the bisphenols, which are certain or very likely endocrine disruptors. We have several phthalates as relevant members of the endocrine disruptors family.
Okay, this is one question was talking about how important the work is, looking at the pairs of exposures and outcomes, and wondering if you plan or know others who will look at the mixtures of exposures next.
So the world mixture includes several questions. I would say if we are talking about mixtures in terms of synergetic effects, my view, and I'm here relying on reviews from colleagues from toxicology, such as publication first authored, I think, by Olwen Martin and last authored by Andreas Kortenkamp, showing that for many exposures with adverse health effects based on toxicology, the dose addition was the most relevant model, meaning that it was unlikely that there was strong evidence of departure from additive effects. It doesn't mean that the mixtures are not a concern. It means that the cumulative model, the dose addition model, should be used as default, meaning that if you are exposed to 10 compounds to a concentration of 1, it is more or less equivalent to being exposed to one of these compounds to a dose of 10. So for that reason, I'm not certain that we would find a large number of exposures with evidence for synergy, although there's a few, and our colleagues Balaguer and Burguet have published a few very interesting examples. We know grapefruit juice can interact with many other exposures too. So in a word, this is not the next step in our plans. We rather plan to combine all these results to estimate the overall impact on children's health, ignoring any possible synergy between these exposures, but considering the cumulative effect of these exposures.
Okay, thank you for that answer. I have time for one last question, and then we're going to have to wrap it up. And it's about, the question is that benzene was not listed, but perhaps it's covered by cigarette smoke and gasoline natural gas.
Well, it's not explicitly covered. It was rightly identified that we had made the choice that because we don't assess it in the parallel cohort study, we chose not to review the health effects of benzene, which are clear and well known, and in adults, which is a recognized carcinogen inducing leukemias. So part of the effect of tobacco smoke might be due to benzene, but since there are hundreds of other chemicals in tobacco smoke, it's not as if we had reviewed the effects of benzene. So that could be done. And that work should also be updated as the literature continues to expand.
Okay. Well, thank you, everybody who has put in lots of questions. We're not going to be able to get to all of them today.
I'll try to answer some of them if I still have access to these questions afterwards.
Okay, well, that is very
I'll do my
kind of
best
you, Rémy.
without making any promise.
Excellent. So, I mean, I want to just thank you, Rémy, for being with us today. We really appreciate that you took the time to share this piece of work from you and your team. I would also just like to thank everybody else who's joined us tonight. And I will give the floor back to Elisa for closing down the webinar.
Thank you so much, Shannon, and thank you so much, Rémy, for sharing this important work. Thanks also to all our participants for your thoughtful comments and questions. I'll wrap up now with some quick announcements. A video recording will be available on CHE's website soon, and you'll all receive an email with a link to the video. We encourage you to support the work of the EDC Strategies Partnership. You'll find links to each member group on CHE's partnership page. If you appreciate these webinars, please consider a tax-deductible donation to CHE and/or any of these partners. Please also join us on April 24th for the next CHE Alaska webinar, Childhood Cancer and the Environment Prevention Opportunities. Please see the link in the chat. We'd like to thank you again for joining us today. Thanks again to Rémy for taking the time to talk with us and Janan for moderating the webinar. And thanks to Kristen Schaefer for her help behind the scenes. We hope to see you all again on future webinars.
Thanks a lot on my side too.